so let's talk a bit about knee arthritis. Now, just as a side note, the word arthritis, or the term arthritis, okay, it's a very broad term. Now, the type of knee arthritis I'm going to speak about here is this knee osteoarthritis. Osteoarthritis. And in osteoarthritis, this basically means the mechanical wear and tear of the cartilage in the knee joint. Okay. Now, the other types of arthritis, as I mentioned, for example, rheumatoid arthritis, which is an autoimmune condition that does affect the joints. The mechanism is a bit different. And there's also gout, which is another type of arthritis. We won't be getting too much into that. Rather, we will focus on the classic osteoarthritis, or what is generally referred to as arthritis. Okay, so this here is just a general schematic of the knee. Okay, this is the femur, tibia, and the fibula. Upper leg, lower leg, and your knee joint. Now, the knee joint is held together by ligaments. Okay, ligaments. Also, there are muscles that cross the knee joint that stabilize the knee joint, and of course, there's the cartilage. Now, in the osteoarthritis, there is wear and tear of cartilage. What happens is when you do the X-ray, what you tend to see here is a narrowing of the joint space that basically represents wear and tear of the cartilage. Okay, so what are some of the causes of knee osteoarthritis? Okay, first we have knee trauma. For example, those who play sports. Let's say you're playing football, somebody tackles you bad and you get a knee injury. Now, when the knee injury heals, the knee may not heal properly lined up as before. So what you have here is certain mechanical imbalances that then basically put excessive strain on certain parts of the knee cartilage. And this causes greater and faster wear and tear of the knee cartilage, and that is what predisposes you to the early arthritis of the knee. You have being overweight. Now, if you're overweight, what happens is that the knee has more work to do, and there's more stresses and strains on the cartilage, leading to greater wear and tear of the cartilage over time, and that is the mechanism by which being overweight can lead to knee arthritis. Then there's pelvic tilting. For example, if you have a scoliosis, a mild scoliosis of the spine, okay, let's say that's your spine, that's the sacrum, then it attaches to the pelvis. Because of the spinal curvature, you can end up with a tilting of the pelvis. So as you can see in this diagram here, let's say this is the right side, that's the left side. So what's going to happen here is that because of the tilt, in this case, you're possibly more likely to put more weight on the right leg, and hence the right knee. So the right knee is going to bear a greater percent of the weight of the body weight than the left knee, and again, to greater stress and strain on the knee structures is what is going to lead to greater wear and tear of the cartilage. Okay, so pelvic tilting, maybe due to scoliosis, can lead to arthritis. And what you may find is that the arthritis may preferentially develop on one side. Then we have pronation or supination of the feet. Now, if you look at down here, okay, let's say for example, your feet are overpronated. So when I say overpronated, I mean the feet are turned inward like this. When the feet are turned inward like this, there's a tendency for the knees to bow inward. Okay. Now, when the knees bow inward, the outer part of the knee is going to take greater forces than they really should. Okay, and that is going to lead to wear and tear of the cartilage on the outer part of the knee. Now, if you're supinated excessively like this, and the knee tend to bow out due to the supination of the foot, what's going to happen is the inner part of the knee is going to bear more weight than they should, and that's going to lead to grinding out or wear and tear of the cartilage on the inner part of the knee. Okay, so spinal and pelvic imbalances can lead to knee arthritis, as well as issues with the foot too as well can lead to knee arthritis. So in dealing with knee arthritis, while it is a good idea, of course, to deal with the knee directly, you have to go a bit above and below to see if there are other contributing factors that are leading to or worsening the knee arthritis. Okay, so now we come to the treatments for knee arthritis. Okay, so if a person is overweight, obviously losing weight is a big factor. What you want to do, you want to offload the knee as much as possible, and by losing weight, that will achieve that. Now, of course, this is a long-term process in many cases. Okay, it's not easy in many cases as well, and if you're having difficulty doing it, you can always seek professional help, for example, a dietitian. Okay, a dietitian can definitely guide you where proper weight loss is concerned, and do it in a manner where you don't rebound and regain the weight, because you definitely don't want that. Therapy. Now, when it comes to therapy, there are certain goals that therapy would have. That would be to strengthen the knee, also to increase mobility. Okay, and one of the ways to achieve that, of course, is to increase the flexibility of the muscles and the joint. Okay. Okay. Now, where strengthening the knee is concerned, remember with the knee joint. Okay, again, I come back. Here's a rudimentary diagram of the knee joint. Okay, so you have the bones, of course, you have the ligaments and the cartilage here, but also remember the muscles. Okay, the muscles that cross the knee joint are responsible for the strength of the knee joint. If the muscles are weak, then the ligaments and the cartilage have a bit too much work to do. And what you're going to get here, it is increased grinding out of the cartilage or wear and tear of the cartilage. You can also get ligamental strain. So in the whole arthritis picture, while there is cartilage wear and tear, you're also at a risk for ligamental strain because in many cases you're also going to have weaker muscles. And if the muscles are not doing their job, then the rest of the structures, they have to do additional work, which puts them at risk for injury. Okay. Mobility and flexibility, they go hand in hand. What may happen is over time a person may develop stiff muscles, tight muscles, because maybe they're not as active as they should be. So now you have wear and tear of the cartilage, and then in addition to that, you're going to have stiff muscles, which then tends to restrict the joint movement. And in the flexing of the tight tissue, that can also lead to an additional level of pain. So what you may have on the knee joint is pain due to the cartilage wear and tear, but also the other additional supportive structures or the soft tissues, which are not flexible and which are painful when you try to flex and extend them. Okay, so that is what therapy does. Okay, and therapy, again, where the flexibility and mobility are concerned, you can be given certain exercises by a therapist, but also to massage therapy can also have a great role in increasing the flexibility and the mobility of the structures associated with the knee joint. Injections, there are injections that can be given directly into the knee joint, and we'll go over those in a bit more detail, but the main injections that we will cover in a while will be the steroid, PRP, and a gel injection. Okay, we'll go through this here in a little while. Surgery or knee replacement surgery. You could have a partial knee replacement surgery or a total knee replacement surgery. Surgery is the last resort. When everything else has failed, you've done the therapies, you've done the injections, and what happens is now it has all failed, and you may be very well forced to do knee replacement surgery. Typically, knee replacement surgery is not done before age 55 because a knee replacement has a lifespan, approximately 15 to 20 years. If you do it too early, by the time 15 to 20 years up, you have to do a revision knee replacement surgery. So it's always best to do it at an age where very likely only one surgery will be needed. Okay, so now we're going to go into the injections in a bit more detail, and we will see also that injections are not standalone. So we'll discuss three basic types of knee injections: steroid injections, PRP or platelet-rich plasma, and a gel injection. Now with the steroid injection, steroid is already an anti-inflammatory. Okay. Anti-inflammatory. Okay, so let's just say this is your knee joint here again. Okay, and there's some arthritis taking place. You're having some joint, you're having some cartilage wear and tear, and then you have inflammation going on here. Right? Remember, that is an injury, that grinding that way into here, that's an injury that's going on there. You're going to have an inflammatory process. And remember, you have nerves that innervate the knee joint, and the inflammation, it irritates the nerves, and then the brain is going to interpret that as pain. Now, with the steroid injection, this steroid injection is given directly into the knee joint. So you can have a syringe. Okay, here's your syringe. Okay, and when you give the steroid injection, it brings down the inflammation, it reduces the inflammation. And many people who do the steroid injection, what happens is within a couple of minutes, they can report a reduction in pain, okay? And they actually, it's a same day process. Come to the office, the surgeon or the specialist or the doctor will give an injection directly into the knee joint, and that will reduce the inflammation. So within a couple of minutes, the person can report a dramatic reduction in pain, and they walk out the same day. If you drove to the appointment, you can drive back home again. So that is what the steroid does. Now, the steroid does nothing to actually repair the cartilage. It just reduces the inflammation, which means I highly recommend that you do therapy to really maximize the use of the steroid. Some people, when they start therapy, it's really painful, and they can't really do the therapy well, the exercises, they can't do it. Steroid helps. So you inject the steroid, bring the pain down, and now the person can do the exercises or do the therapy, because now the pain levels are reduced. So that's the steroid injection. With PRP, now PRP, like I said, is platelet-rich plasma. So what happens is around 20 mils of your blood is drawn out of the vein. Now that is put in a centrifuge, and the test tubes are spun down in a centrifuge, and what it does is separates the blood into a couple layers. So that's the tube here. Okay, it's going to separate out into a couple layers, and the top layer here contains platelets as well as healing factors. Okay? That is a general term I'm using for certain components in the plasma. Okay, and this top layer here, or this layer here, is drawn into a syringe. Again, so here's a syringe. Okay. Right, this goes into here when you draw it up. And what this does, the healing factors in the platelets, what they do, it is that they help with the regeneration of cartilage. Now, this does not work for everybody, and the people who you would give this to will not have very severe arthritis to the point where it is quote-unquote bone rubbing on bone. That is not for those people. You would give this to people who still have some cartilage within the knee joint. Okay, so this is not for the whole bone-on-bone situation where it's grinding and there's almost no cartilage left. There still must be some cartilage for this to have a chance of being effective. Now with PRP, it's not a one-time treatment. Normally this will be 3 treatments given at over a period of each treatment will be 4 weeks apart, approximately. Okay, 4 weeks apart. So that is how PRP. That's a general overview of PRP, or platelet-rich plasma. The gel injection. When it comes to the gel injection, now let me delve into the principle as to what the gel injection is about. All the time we've been talking about the structure of the knee. I'm talking about the bones, the ligaments, the muscles, the cartilage. Okay, again, knee joint here. Now, one component we did not speak about is the synovial fluid. The synovial fluid. So, that's the knee joint here. And within here, there is a fluid, a lubricating fluid called the synovial fluid. Now, the synovial fluid, it's not a water, it's a bit more of a more oily consistency. And what happens is that it helps to lubricate, and it helps to help the knee joint to move a lot easier. And what happens is, as you get older, the synovial fluid loses the viscosity, and it gets more watery in the picture of arthritis. You can also lose a certain volume of your synovial fluid as well in the picture of arthritis, or as you get older. So to help to deal with that loss of synovial fluid and the reduction of the quality of the synovial fluid, gel injection is given. Now this gel injection is actually made from chicken combs. So what I mean is, So let's say this is a chicken, okay? The combs on the chicken, that is where the gel is made from, okay? So create a gel using the chicken combs, and that is again injected into the knee joint. Now, how steroid works quickly within a couple of minutes within the session, it is not so with the gel. The gel, for you to really begin to see the effects of the gel, it would be, let's say, 2 weeks. Okay? So what the specialist may do, a small amount of steroid may be given with the gel. So you may get gel with a small amount of steroid. And the reason for that is you want to give the patient a bit of a comfort or some reduction in pain with the steroid while you're waiting for the gel to take action. Okay, so with the gel injection, you're not going to get that immediate relief like with the steroid. But the thing about the gel, it does help to some degree help to alleviate the problem by replacing the synovial fluid, giving a little bit of more lubrication within the knee joint itself. Okay, so again, because it takes about 2 weeks for you to really begin to start to see the effects, you will want to cover that period with some steroid. Now, so when it comes to these injections, steroid, PRP, and gel, with all of these here to really maximize, you want to definitely combine with therapy. Okay. Now, we don't want you to look at these injections as the solution, the only part of the solution. They are part of the solution, but you really should be aiming for therapy, because therapy will really allow you to maximize the benefit of the injections. Remember, with therapy, you're going to strengthen the knee, you're going to add strength, you're also going to add mobility and flexibility. Okay. Now, as part of your therapy, sometimes a person may need to wear a knee brace. Now, I'll just talk about knee braces in 3 main categories. I'm sure that we can subdivide and get even more categories, but let's just keep it simple. So let's talk about the knee braces for a while. So you have knee braces. Okay. So for the knee brace, there's the traditional sleeve. Okay, that's just the knee brace. It's the elastic piece of cloth. You slip it on, you just pull it up, and the sole generally has a one size fits all. It has a fair amount of elasticity, so for a large part of the population, it would fit. Okay. The disadvantage with the sleeve is that you really cannot adjust the tension. Okay. When you pull that sleeve up, that's it. There's no adjustment. Then you have those that are also fabric, but they are adjustable. Okay, that's where they can be Velcro. So with these here, sleeves, they will be able to open up. Okay, you put it around the knee, then you pull the straps and you Velcro, and you pull it as tight as you need, or as tight as it is comfortable and supportive. So that's the next one, the fabric. Sometimes with the fabric, you may have some plastic spines or some plastic support built into the fabric on the side, just to give some additional support to the knee. And then we'll have those with the also fabric, but also that have metal hinges. Okay, so those knee braces, again, you will open them, your fabric, you open them up, you Velcro. But what happens there, the hinges on the side, they are metal, they're metal hinges, so they actually can be very good for a very heavy person. That will give a lot more support than fabric with a plastic support. Okay, so for very severe knee arthritis, you may want to really consider having those with the metal hinges that are adjustable. So when it comes to therapy, exercises play a large role when it comes to strengthening the knee. Now I just want to harp on something here. When it comes to the exercises, I really do mean a big part of it is resistance training. Now with resistance training, you can use items like ankle weights, resistance bands. Okay. Again, these are the general items that you would use. Maybe it's just traditional gym equipment, but of course you're going to use weights that are suited to you. You're not going to attempt to do like 100-pound leg extensions and these sort of things. You're going to keep the weight for the purpose of rehabilitation. Okay, so resistance training is great for rebuilding the strength of the muscles that support the knee joint. Walking is fine. Walking is great for keeping the mobility and the flexibility. Okay, so we'll go with that. However, running and jogging are out. If you're trying to treat knee arthritis, I would stay away from running and jogging while you're in the rehab phase. Okay, running and jogging, no. This is because running and jogging, these are forms of jumping. Okay, so you can imagine if you have knee arthritis and you're jumping on the spot, you can appreciate how that can be detrimental to the knees, and seeing that running and jogging are actually forms of jumping that too can be detrimental. Now, if you are walking, the footwear is important. You have to have proper footwear. Okay? Proper footwear. Remember we spoke about the feet being overpronated or supinated. So imagine if you have your feet like this and you're doing walking, this here can actually be more detrimental because now you're using the knee while it's in a bad position. What you want to do is get proper insoles to help to deal with the overpronation, take the foot from that position to a more level position, which will take some strain off the knee, and then you can do your walking. While you're walking, you can also wear a knee brace that is suited to the activity that will also give the knee the additional support. Okay, so walking is fine, but look at your footwear and maybe possible knee bracing too as well. Okay, knee bracing. Okay, so yes, so that's what it's, so that's an overview as to some principles to the knee exercises that as they apply to knee rehabilitation or knee arthritis.